Hi everyone, I'm Dr. Pradeep from AKG Hospital, Kannur. I'm an India specialist. Today we'll discuss about the self-evaluation of COVID-19 infection. Hi, so let's evaluate whether we have any symptoms of COVID-19 and if yes, what shall we do? So we will decide the treatment protocols and criteria or those things based on a history from your side. So, first of all, get a paper and a pen and be ready to answer the following questions which I am asking you right now. First, did you travel to anywhere outside your country in the recent 2 weeks' time? If yes, you can write 2, and if no, you can write 0 and keep a plus mark so that you can add the scores from now on based on the following questions. Next, did you travel to anywhere outside your district recently? Well, if yes, add 2 to your score. If not, add 0 to your score. Did you have contact with a COVID-19 positive patient, that is the patient who has been diagnosed to have COVID-19? If yes, then write 0. If not, if yes, then write 3, and if not, write 0. So now I'll ask you questions regarding symptoms what do you have right now. Do you have cough or cold right now? If yes, write 1 or write 0. Do you have sore throat or loose stools or body ache? Then write 1 if you have. If you don't have, write 0. Do you have fever? Then definitely write 2. And again, if you have fever, write 2. That is, add 2 to your current score. If you have any breathing difficulties, then add 1 again. If not, write 0. If you are a healthcare worker or a public servant who is on COVID duty and who has likely to get exposed to patients or people around you, then you have to write 1 or add 1 to your current score. If not, just add 0. Now let's evaluate based on the current scores you have. So now add your scores to, it may come to less than 4 or it may be 4, 5, 6 or even above 6. So let's evaluate based on this table. So if you have a score which is less than 4, then you should remain in home isolation. It doesn't mean that you have any disease, but you are less likely having any disease. And you can take over the counter drugs from your nearby pharmacy for cold or body ache. You should avoid taking medication for fever or breathing difficulty because fever and breathing difficulty in the next 2 hours can change to severe symptoms. So now if your score is 4 and above, not more than 6, then you need to consult a nearby doctor and get the COVID-19 test done. You should also consult your doctor if your score is less than 4 but you have fever, or you have a score less than 4, still you're a cardiovascular disease patient, then you should consult your doctor or your cardiologist so that there is no worries. And also, based on the questions I've asked regarding the symptoms like cold, cough, sore throat, loose stools, body ache, fever, and all those things, if you have a score of 2 with the following conditions like lung, heart, liver, kidney, neurological diseases, hypertension, hematological disorders, uncontrolled diabetics, cancer, HIV, AIDS, or you're on a long-term steroids, or you're on an immunosuppressive drug, which is usually taken by patients who are under chemotherapy, or if you're a pregnant lady, or your age is more than 60 years. So these patients has to consult a doctor or get opinion from an expert whom they know. And if your score is well above 6, you are most likely to have a COVID 19 infection, and you should very well visit a hospital, get admitted, and make sure you are being put in an isolation ward and the COVID 19 test is done. This evaluation is prepared on the basis of WHO COVID-19 guideline, a national task force for COVID-19 guidelines. And here are the references which I have used. Thank you so much, and take care.